So this summer, we have two different projects that are going on. Both of them are focused on goats. The first project pertains to urinary blockage in goats. So it's similar to when a human has a kidney stone. Urinary blockage in small ruminants is probably our most common emergency we see after hours. And it's one of the most frustrating ones to treat. So this summer, Dileydis is going to be working on establishing a therapeutic dose of a pain medication called phenazeparidine. Phenazeparidine is a medication that's used in human medicine to help relieve discomfort with urinary tract infections in women. And it's been used in food animal medicine for a long time. So this summer, we're going to determine the therapeutic dose, the dose that'll help alleviate discomfort in a group of healthy goats, and then perform a clinical trial in the fall in goats with urinary obstruction. The second project is going to be under Sara's wing, and that's looking at different sample sites to assess a blood glucose measurement. So in humans, blood glucose is typically measured for patients that have diabetes. That's not usually a problem in small ruminants, but we do have a lot of hospitalized goats that we need to take serial or continuous blood glucose measurements on. We usually get it from the jugular vein, but some goats do not like having their jugular vein poked, or it's really hard when you have very limited staff. So we're going to determine if we can collect blood from the ear, and if that'll match what our blood glucose measurement is in the jugular vein.
So for the phenazeparidine project, I will be work with most of the hands-on sampling experience. So I will be helping Dr. Halleran and other clinicians placing IV catheters on their jugulars, and also collecting blood samples and urine samples after each dose of phenazeparidine. Since we will have a week of washout between dosing, I will be helping with Sara's project on getting those blood glucose samples as well from the jugular. So yeah, pretty much we will be working together in both projects in the lapse of 3 weeks. So after we have pre-collected all these samples, we will be collecting plasma from the blood, and also freezing out those samples and the urine samples for further analysis for next semester, as Dr. Halleran mentioned.
My project is going to be looking at the blood glucose levels in the ear versus from the jugular vein. Sample-wise, I'll be helping a lot with Dileydis' project in terms of putting in the jugular catheters, as well as taking blood samples. And then for my project, it'll be very similar. So we'll get some samples from the jugular vein, and then we'll also get some samples from the ear, which is basically just kind of poking the ear with a needle. Since you only need 1 drop of blood in order to run the blood glucose on the portable glucose monitors. I will have my data pretty immediately, since those monitors give you the amount of glucose in the blood right away. So I'm hoping that I'll also be able to help with some of the statistical analysis, which will help me in writing my abstract and presenting my poster at the end of the summer, which is one of the main parts of the VSP.
The first thing that caught my attention while reading the VSP research project was that it was working with goats, pretty much. I really was aiming to get more hands-on experiences and getting small ruminant practice before going to clinics, of course. So after Dr. Harens gave a lunch talk at the beginning of the semester, I was really fascinated by all the work that she did. She's a clinician, she is also a researcher, and she's a professor. So I was like, she has an amazing background to support us as students that are interested in the farm animal field, to get a better insight of what it's like being a veterinarian and getting all that hands-on experience.
I haven't had the opportunity to do a lot of research. I haven't really done a formal research project since my senior year of high school. And I wanted to make sure that research is something that I would be interested in, and kind of keep that as an open option for the future. Once I saw that this was an opportunity for students, I thought the VSP program was a really good fit because of the awesome mentorship opportunities that kind of helps guide you through the research process, so that I wouldn't feel too overwhelmed and kind of unsure on how to proceed. I have really loved working with Dr. Halleran. She is super nice, and the way that she communicates information is always at a very understandable and attainable level. Especially as a first-year veterinary student, sometimes a lot of this stuff is we haven't quite covered it yet in at my time in the curriculum. So it's been really great working with her. She's been a great mentor, and yeah, I feel comfortable asking her questions. Overall, just been a really positive experience.
It's been a pleasure working with Sara this summer so far. She came into a hard spot where both Dileydis and her had signed up for the phenazeparidine project, and we kind of just created the blood glucose project on the spot. But she's taken it by the horns and has just ridden with it. So I really appreciate her enthusiasm and her audacity for wanting to take on a project that we just developed.
Yeah, it has, as Sara mentioned, it has been an amazing experience being under Dr. Halleran's mentorship. She has been very patient and very straightforward about the project. She has helped us both understand each of the projects. So although Sara and me are doing different topics and different research during the summer, she has involved both of us in both of the research, so we have a better comprehension of each of the topics. Well, some topics and some words might not be familiar for us. She has made it way easier for us to understand and be hands-on on each of the experiences.
I really appreciate Dileydis' enthusiasm. She has been very motivated and keen to get to work right away. So she already has her abstract written for the project and a bunch of manuscripts already annotated with notes to help further her understanding of the project. So I think it's really refreshing to have students that are super enthusiastic, super compassionate, and interested to learn.